Well, we have some big breaking news coming in from Karnataka. Shocking incident from Karnataka's Bellary, where a doctor has been brutally beaten by a deceased son. In fact, enraged by the fact that the parent has passed away owing to COVID. The son has attacked the doctor, accusing her of not taking care of his father's situation at that point of time. Shocking incident in Karnataka's Bellary, where a doctor was attacked by the son of deceased COVID patient. The woman doctor was assaulted by the son in a fit of rage, accusing her of not taking care of his father's situation, leading to his death. Let's quickly cut across to Nagarjun, joining us for more details on that. Nagarjun, if you can take us through what exactly happened, a small glimpse into the situation right now of the doctor.
This incident happened on Sunday, that is the 23rd of May, in Vijayanagar Institute of Medical Sciences in Bellary. So the patient passed away on Sunday after battling the COVID disease, and the son of the patient thought that the hospital didn't give enough care and accused the doctors of being negligent. And that's the time, in a fit of rage, he tried attacking the doctor. Dr. Priyadarshini was the one in a PPE kit in the video that you can see was pushed and assaulted. And that's when the police swung into action and the district officials swung into action, booked the case, and also have already arrested the accused in the video that we are saying is Tippeswamy, who's 31 years age, and he's the son of the person who passed away due to COVID. And this is not the first time that health workers and doctors have been assaulted in Karnataka.
All right, now let's take you through the situation of several parts of South India. While you have the lockdown in place, you have Covidiots still on the prowl. South India most definitely is still in the grip of the second wave of COVID-19. I'm going to take you through some of these instances that really left us surprised and shocked. Absolutely irresponsible behavior. Our next report here from few parts of southern India. Let's take a quick look where we're seeing brazen COVID-19 violations.
A private wedding flight with over 160 guests over Tamil Nadu. A huge religious crowd for a goddess in Andhra Pradesh. A funeral procession for a horse in Karnataka. The second wave is far from over, but Covidiots still reign supreme. 3 stories of shocking COVID violations in 3 states that are locked down. Presenting this week's high-flying Covidiots. With 161 guests stuffed into a chartered flight, this couple tied the knot just as the aircraft flew over the sacred Meenakshi Amman temple in Madurai. With Tamil Nadu in lockdown, they chose to violate protocol and laws 35,000 feet in the air. The flight lasted a total of 2 hours. While all had taken RT-PCR negative certificates along, such a congregation is in complete violation of the rules. No action has been taken against them yet, with police perplexed about how to act on this violation. Now say hello to Covidiots number 2 for the week. This time from Andhra Pradesh's East Godavari district. Hundreds of devotees crowded at the Gogulamma Thalli temple to please the goddess. This is totally in violation of Section 144 and lockdown at a time when the positivity rate in Andhra Pradesh is a very high 20.48%. Cases under the Disaster Management Act have been registered and the organizer has been taken into custody. And finally, Covidiots number 3 in Karnataka's Belagavi, where hundreds of villagers gathered to attend a funeral of a horse which belonged to a local mutt. Villagers believed it's a divine horse and hence this big send-off. Huge crowds despite a state in lockdown and high numbers for weeks together. 15 organizers have been booked by the police and 400 houses have been sealed thanks to this violation. No end to COVID yet. and certainly no end to Covidiots. With Pramod Madhav, Nagarjun Dwarkanath and Ashish Pandey, Bureau Report, India Today.
Now, with fears of the second COVID wave involving many more children arising, in fact, in Karnataka itself, we're looking at least 40,000 children who've been infected with COVID-19 just in the last 2 months. Owing to the rise in cases in Bengaluru, they've now set up a nice COVID care center dedicated to children. Nolan Pinto brings us this report.
These children are all busy with their day's work. Some are watching movies, some are playing board games, and some are speaking to their caretakers in PPE suits. This is Bengaluru's Divine Grace Institution, a 75-bed COVID care center for children. Most of these children are COVID positive, with some of them being on the verge of recovery.
We have two types of children. One is already with child care centers, that is, children those who are in CCIs, and some of them turn positive. And I know in Bangalore itself, so we had one case actually. The child was just turned 19, and child was left alone because uncle and auntie left because of the sickness. And father and mother is not there. So night 11:30 we went and picked up their girl.
This center began in just 10 days' time after many NGOs and hospitals collaborated after securing permission from the Health Department and the BBMP under the supervision of the Child Welfare Committee.
There is a dire need for centers like this because very heartbreaking stories about, all the family members in hospital. The children are also positive. Relatives are unable, or family friends or community are unable to take care of them because they themselves have people with comorbidity to be exposed. So it's a massive risk. So what do? How do you take care of them?
The children have to follow a set routine every day, as is seen in the daily activity sheet. From waking up by 6:30 in the morning to drinking kashayam at 7 a.m. and then completing their breakfast with badam milk by 10 in the morning.
Our hospital is basically looking after setting up this unit, providing expertise in terms of buying the equipments, provision of the gas, the oxygen concentrators, etc., and training the people who are here to look after. Our aim is to do virtual rounds, so staying at our hospital, we have this platform and then we do the virtual rounds.
In case these children need to be shifted to a hospital in an emergency, the Rainbow Children's Hospital then comes into the picture.
If any child here gets worsened with difficulty breathing, where they may need support with ventilation, or if they develop a condition called COVID-related multi-system inflammatory syndrome, and they need special medicines which can only be done in ICU, those are the kind of support we'll be providing this COVID care center.
So this is all about treating COVID-infected children in an atmosphere that is quite unlike that of a hospital, but with all the support systems in place so that in the end, they do not get mentally affected. With video journalist Madhuar, Nolan Pinto for India Today.
Now, children quite naturally are the most vulnerable. In fact, there are several cases that's come to light where COVID has claimed both parents' lives. So children have been left as orphans. There's also fear and threat of child trafficking. Just to ensure the children are in the right hands, there's an NGO in Bengaluru called SOS Children's Villages of India, where they're now ensuring that these children are safe and protected. Nolan Pinto with this report.
These children might seem to you like any other, sitting together and enjoying the lockdown. In reality, they are victims of this pandemic. They are COVID orphans whose parents, both mother and father, have died due to the dreaded COVID virus. These children are the nobody children now. This issue is primarily more damaging, especially for those from the economically weaker sections of society. The children do not have anybody to look after them. This is where SOS Village has stepped in. They're today looking after 9 COVID orphans at their facility in Bengaluru.
Children either need short-term care since their parents are suffering from COVID and are undergoing treatment, or are in need of long-term care because they have lost parents to COVID. SOS Children's Village takes care of all needs of such children till the time either they are reunited with their families or they become self-reliant.
The only option is to keep these children mentally active so that they do not go into depression after what they've gone through.
These children are engaged in various activities in the family homes with a lot of indoor games and online education. So many things they are getting involved with other children so that their mental stress get relieved. Some of the children they do not have anybody or they don't have any biological family members, but these children are giving a loving family in SOS under the loving care of the mother and other children.
So the SOS Village group makes sure there's a caregiver who will look after them as her own children.
कोरोना का टाइम में 2 बच्चों मिल गया, वो बच्चों हमारा बच्चों के साथ मिल के एक्टिविटीज़ में पूरा होता है, खेलता है, हम लोग पूरा मिल के वो बच्चों को पुराना याद नहीं आने के लिए मैं कोशिश करती हूँ.
According to the Karnataka War Room, 39,846 children aged between 0 to 9 years, 1,05,044 aged 10 to 19 have tested positive between March 18th and May 18th this year. So this group is also focusing on ensuring these kids are kept safe from the virus. They've ensured that these children don't suffer more. They've already lost their parents, but not their future, thanks to such COVID heroes. Nolan Pinto for India Today.
Now, cutting our focus to black fungus cases that's on the rise across the country. Karnataka is no different. 700 cases have been reported in Karnataka alone. At a time like this, of course, several questions raised on the cause. What's the reason for black fungus resulting in more number of COVID-positive patients? Of course, doctors have stressed time and again that it could be due to uncontrolled diabetes, excessive steroids or prolonged use of oxygen. In fact, multiple factors, even if you're immunocompromised. But here, doctor has said, an ENT surgeon who's an acclaimed doctor, Dr. Deepak Haldipur, points out at mutant strain being the common factor among those who've caught black fungus. Let's take a quick listen. Earlier, it was understood that maybe those with diabetes or those who are immunocompromised, but now we're seeing people who are absolutely fit, who are young, who possibly didn't even know that they had COVID unless they did an antibody test, have now landed up with black fungus. So what's the worrying trend here?
We have seen mucormycosis in patients who were treated at home. They have only taken tablets. They have not got admitted in any hospital. They have not taken any oxygen, any humidified oxygen.
No steroids as well.
No, yes. And number 2, till this COVID everything came, you notice 2 things. Even before diabetics were getting admitted to ICU, we were giving steroids for status asthmaticus, other brain surgeries. They were not getting this.
Correct.
This is not due to steroids. That's what we thought initially. No.
Yeah.
The 3 common things in the largest series I have seen. Number 1, the mutant COVID virus. Number 2, most of these people are not vaccinated.
I'm not a diabetic and I do not have any comorbidities. I'm not on steroids. I was not on any kind of oxygen support system.
Okay.
And I was not also aware that I was a corona patient.
Okay.
I had corona. I got admitted to the hospital. When I was done an antibody test, the doctors came to know that I had corona. It was asymptomatic.
Okay.
I never knew, I never had any kind of symptoms.
Now, Tamil Nadu has already imposed a lockdown. It seems now like an extension of the lockdown has been imposed. Here is Pramod taking us through all the stringent curbs that are currently in place in Chennai. Let's cut across.
After 2 weeks lockdown announced by the new Chief Minister M.K. Stalin, Tamil Nadu is entering a third week of intense lockdown. This means grocery stores and even vegetable stores will not be open in the state for 1 week. That is from 24th May to 31st May. And for even inter-district travel, you would require an e-registration, which you could see the police over there checking from a person inside the vehicle. And even this e-registration passes will only be provided for medical emergencies and to attend a funeral. Such restrictions have been brought in to make sure that the movement of the public is curbed after the state for almost a week is reporting 35,000 plus cases per day. And not just that, to make sure that people get adequate vegetables and fruits, the state has also decided to go ahead and use mobile vehicles to sell vegetables and fruits, by which in the city of Chennai alone, 2,600 mobile vehicles will be selling fruits and vegetables, and for the other parts of the state, 2,770 mobile vehicles will be used for this purpose. This is a very prominent area in Chennai called as Egmore, and here you could see policemen checking each and every vehicle if they are carrying a valid pass or not, or else they have to pay a fine. With video journalist Divyan, Pramod Madhav for India Today.
All right, shifting focus to Telangana. It seems like after a lot of criticism over the police department of high-handedness, this video from Yadadri, Telangana district, has really come as quite a heartwarming footage that you see here. Telangana currently under strict lockdown. Monkeys in the temple town of Yadadri are struggling to find food, and now Telangana cops are winning hearts of many as they come to the rescue of these monkeys. The men in khaki were seen feeding these monkeys as the most famous Lakshmi Narasimha Swami temple at Yadadri is closed due to lockdown, and in summertime, the summer heat, monkeys living around are struggling for food. No people coming there. It seems like the cops have come to the rescue now. All right, we have some big breaking news coming in.
Good morning, ladies and gentlemen. Request all of you to remain seated, please. Thank you. Ladies and gentlemen.
Here's some big breaking coming in. DGCA initiates action against those who carried out a wedding, Madurai wedding, right in the aircraft. The controversy has now escalated to the DGCA initiating action. The crew has been off-rostered. The airline has directed to lodge a complaint against those not following COVID-appropriate behavior with relevant authorities. It was quite shocking to see a family in Madurai who booked an entire aircraft and then carried out a wedding inside that plane against all the COVID rules in place, of course, against the DGCA guidelines as well. And here we're looking at the DGCA initiating strict action, saying that the crew is off-rostered. The airline directed to lodge complaint against those not following COVID-appropriate behavior.
Ladies and gentlemen, we request you to kindly Good morning, ladies and gentlemen. Request all of you.
Let's quickly cut across to Rahul Srivastav joining us on the phone line. Rahul, the DGCA now taking quick action, asking for the entire crew to be off-rostered. Do take us through what more is the action taken there.
Nabila, there are multiple layers of violations which have happened. There were 166 odd passengers on this flight, which took off on Sunday, and it was in air for nearly 2 hours, during which this marriage ceremony took place. Now, if one looks at the footage, there is a huge violation in terms of not wearing masks, social distancing, and others. Now, following the first wave of pandemic and the slow easing, the government DGCA had come out with some very strict rules that those passengers who do not follow the social distancing and other protocol, COVID-19 protocols, will be deboarded and police action will be initiated against them. Here you see that there is an airline which is carrying passengers who are violating, and still there is no action being taken. So the crew which had the responsibility of ensuring this action, one, they have been derostered, and second, importantly, the airline has been asked to take appropriate action against the people who were inside the flight with suitable authorities. That means whichever police station and other cases can be registered against them now.
Thank you very much, Rahul, for joining us with those details. Now, the Madurai family also will be taken to task. Those who carried the wedding inside the aircraft, the entire airline crew, or that flight's crew, has now been derosted for violating COVID guidelines. All right, I'm going to take you through this very interesting video here. I'm going to leave you right there with this footage of the police in Bengaluru garlanding all those Covidiots who are violating COVID-19 protocols and lockdown norms that are in place, and actually conducting a puja, just very sarcastically praising them for their idiotic behavior.